Understand anatomy and physiology that relates to facial electrical treatments. Questions that may come in your exams. 1. Explain the position of the primary bones of the skull and shoulder girdle and the functions of the skull. 2. Explain the positions and actions of the facial muscles. 3. State the definition of origin and insertion of a muscle. 4. Explain the basic structure and function of skin. 5. Explain the skin characteristics and skin types of different ethnic client groups. 6. Explain how aging affects the skin and limits the effectiveness of treatment. 7. Explain how endocrine system affects the skin. 8. Explain the function of blood and the principles of circulation. 9. Describe the structure and function of the heart and arteries, veins and capillaries in the face. 10. Explain the structure and function of the lymphatic systems, including lymphatic vessels, nodes and lymph in the face and neck. 11. Explain how to identify erythema and its causes. 12. Explain the principles of lymph circulation and the interaction of lymph and blood within the circulatory system. 13. Explain the basic principles of the central nervous system, motor points, and autonomic system. 14. Explain the effect of electrical treatment on the facial muscles, skin, and more. Understand the contraindications and contractions that affect or restrict facial electrical treatments. 1. Explain the contraindications which prevent facial electrical treatment and why. 2. Explain the contraindications which restrict treatment and why. 3. Explain the possible contractions which may occur during the treatment and how to deal with them. Understand how to carry out facial electrical treatments. 1. Evaluate the benefits and effects of electrotherapy machines, which combine different currents and their effects. 2. Evaluate the benefits of products available for facial electrical treatments and their effects. 3. Explain the type of currents produced by direct high-frequency units, galvanic units, EMS units, microcurrent units, and lymphatic drainage equipment. 4. Summarize the physical effects created by the use of the equipment. 5. Explain why some facial treatments should be conducted in a certain direction. Understand how to provide aftercare advice. 1. Explain why it is important to give aftercare advice. 2. Explain the lifestyle factors and changes that may be required to improve the effectiveness of the treatment. 3. Explain post-treatment restrictions and future treatment needs.